Hey there, Dr. Mitch with TX. I want to introduce you to a new series that we're going to roll out. It's going to be called ThursdayTx, which is just a weekly little bit of information that's going to help you self-treat some of the tissues and some of the parts on your body that might be a little beat up and sore from the week's training. Why Thursday? Well, conveniently it's my rest day in my training cycle, but it also falls at a nice part of the week where maybe some of the training from the earlier part of the week is starting to add up. You're starting to notice areas of your body that are a little stiffer, a little sore, and you still got a few more training sessions left in the week that you're going to want to optimize. And so it's a good day to kind of pencil in a little bit of time that you can spend a little bit of work getting in there, making things feel a little bit better, and getting your performance back to where it needs to be. To kick things off, day one, we're going to start with an area that's a little bit tight on me right now, and it's also tight on a lot of athletes that I work with as well, especially in CrossFit and fitness athletes, is the low back region. Now what we're going to hit is this QL, which is short for the quadratus lumborum. It's a square muscle that runs from the base of the ribs to the top of the pelvis. And what it does, it not only does it side bend the torso, but it helps limit and control the amount of flexion of the spine of the low back. And that's a direction that we go into a lot of in CrossFit and in weight training, is the spine wanting to fall into this state of flexion. And so that quadratus lumborum, or that QL, is constantly on tension trying to resist that motion. It can get a little flamed up. It's right on the low back, not so much dead center in the mid back, but off to the sides a little bit. And we see it often very tense, very toned up in people. So what we got here today is a lacrosse ball. I'm going to show you one of my favorite techniques of getting in there in a kind of a pain minimal or pain-free kind of environment and just being able to hang out and release some of that tension. So we got our box here set up. What we're going to do is lay on our back. Our feet are going to go up on the box. Now when most people grab a lacrosse ball, they drop it right on there and lay directly on top of it. And they can almost black out if they're not careful with that. So what we're going to do is kind of come at it from the side. Now if you can feel around a little bit, start at the most lateral spot of your waist and work your way back. And now you'll be able to drop in there and kind of feel a little indentation of where that muscle kind of starts. We're on the outside edge of it there. That's the direction that we're going to want to come in at this QL from. Lacrosse ball, and we're going to sneak in from the side versus lifting up and going directly into it. So here's what it's going to look like. We're laying flat, feet are up on the box. You'll notice that the back is able to level out on the floor in this position. It's not arched where the ball can get hidden in there somewhere. It's very close contact to the floor. If the lacrosse ball is too much for you, grab a tennis ball. It'll be a little less aggressive. Here's how we come at this though. We're going to roll away from the side that we're going to treat first. So we're going to roll away. We're going to find that spot that you just identified with your fingers. Again, coming at it from the side. We're going to place the lacrosse ball right there. We're going to roll back to where we were. Now it shouldn't be too aggressive at this point. Here's what we're going to do next. Roll onto it from this direction here. Shifting our hips back onto it is going to kind of preface our weight distribution down through that side of the lumbar spine. If that's not enough tension, you can kick a leg over or bring this foot all the way up onto your knee here and just sink into that position. Now scour around for a minute and find a real sticky point or a point that kind of feels a little bit more tender than others. Here's what we want to do. Make sure that you can take a full breath in and a full breath out. If you're in a spot in your spine where everything's seized up and guarded up, and you find yourself not being able to take a breath, you're in a spot that might be too deep, too sensitive at the time, pull out of there. This isn't the right technique for you right now, okay? So find a decent spot that feels mildly tender, and we're gonna take a big inhale and a big exhale. We're gonna do that again a second time. Big inhale and a big exhale. Now you should feel on the exhale, your muscle tissue relax a little bit. The lacrosse ball is able to sink in a little deeper. That's perfect. That's what we want to do. Focus on that, allowing things to just relax, using your breath to kind of modulate that. Again, if you're not able to take a full breath in, go ahead and pull the ball out, try a new position, try a change of position here. Now I want you to think about squeezing the low back. So I want you to push the low back down into the floor, almost kind of pulling your abs on tension, and then relax and contract. Allow everything to just kind of relax out into the ball. What we did there is just squeeze those muscles. The quadratus came on tension a little bit, and then relax, and everything kind of mellows out from there. You can keep working with that pressure. If you're not feeling enough, pulling that leg a little farther over on top. If it's too much, we're rolling back off and away, okay? What I would do is hang out in that position really no more than a minute. A minute, minute and a half is kind of a decent amount of dosage to get in there. Work on your breath count for a few rounds, inhale, exhale, contract, relax once or twice, and see if you don't make some change. Stand up, retest by trying to touch your toes, seeing if the right side feels any different than the left side. Go ahead and repeat on the other side of the low back. That's hopefully something that's going to allow you to kind of get into the quadratus lumborum, decrease some of the tension that's riding out in that area, and set you up for a good rest of the training week. We'll be back next week on Thursday with another Thursday TX. Again, I'm Dr. Mitch from Fitness TX. Thanks for watching.